Hello, this is Dr. Sean, your go-to channel for easy health tips. In Eastern medicine, the condition of your tongue has long been considered one of the key indicators of overall health. Conventional medicine has also conducted studies on the correlation between tongue condition and various illnesses. It won't even take 10 seconds to check. Go ahead and take a look in the mirror right now. I always aim to keep my videos short and to the point, right? Let's hit the like and subscribe now. And here we go. The first thing you need to check is the vein underneath your tongue. There have been studies discussing the correlation between smoking, cardiovascular disease, and sublingual varices. Have you heard of varicose veins? It's when the vein in the lower leg protrudes. Not only it doesn't look pretty, but it also causes symptoms such as heaviness and discomfort in the leg. It's pretty common, and it's happening because of a poor blood circulation. By examining these sublingual veins, you can identify circulation issues more quickly than varicose veins. In this study, they checked 281 people with an average age of 56 for sublingual varices. It's good if the vein looks slightly bluish and not too dark, and their length should be less than 60% of the tongue's length. As you can see in the picture here, it's not favorable if the vein protrudes like worms, if multiple veins are visible, or if the color is dark, especially if it's closer to black. This group was labeled as a grade 1 in the study. They compared the normal group with grade 1. The normal group, or grade 0, had only around 7% with cardiovascular disease, whereas among those with sublingual varices, 33% had cardiovascular disease. Having sublingual varices increased the risk of cardiovascular disease by as much as 450%. Moreover, this risk increased further with elder people. Additionally, smokers tend to exhibit more prominent sublingual varices. If you see sublingual varices in your tongue, it means your blood vessel might not be in a good condition. If you don't have any specific symptom now, but see sublingual varices, please pay special attention to them during your next health checkup. The second thing you need to check is the color of your tongue. The normal tongue is pink, but if your tongue appears unusually dark or purplish, it might indicate the possibility of blood clots. Here's a quick note. When we drink coffee, the color of our tongue changes, right? So make sure to check it after brushing your teeth in the morning. Poor blood circulation in the tongue could affect the circulation to the brain. If both sublingual varices and the tongue's color show a dark shade, it could indicate a risk of stroke. So be cautious. And it's always wise to be cautious even if you're currently in good health. The third one is crucial. It's about the fissure on the tongue. From my experience with patients, the most common thing I have noticed is the division at the center of the tongue. Most of the times, it's related to digestive issue. However, if the tip of the tongue is split, it's a slightly different case. This requires more careful attention because it indicates a position of heart. This concept is not present in conventional medicine, so there's no specific reference for it. However, as I mentioned earlier, in Eastern medicine, the condition of tongue is one of the diagnostic criteria. As you can see in the picture, our organs are reflected on the tongue. The tip of the tongue represents the condition of the heart. It's important to remember these signs and symptoms, and if you feel even slightly not right, you should go to the doctor immediately. Many patients ask whether the fissure on their tongue can disappear. The answer is yes. However, in cases of severe and chronic fissures, the rate of worsening may be faster than the healing rate, making quick recovery unlikely. The most common fissure caused by poor digestive functionality can be effectively treated by addressing the root cause with Eastern medicine. Additionally, Eastern medicine can also address the tooth mark on the side of the tongue. So if any of you feel healthy but want to have a pretty tongue, go to an Eastern medicine clinic and get a pretty tongue for yourself. Did you find today's information helpful? If so, please like, subscribe, and share. I'll be back with simple and easy information next time. Until then, stay healthy.